Welcome to the Vaginal channel. Here at VTV, we are your resource for all things related to pelvic health. I'm Dr. Mia Duncan, and today we're going to be talking about the home UTI test kit. There are a ton of kits available out there, and in my experience as a urologist, urogynecologist, I find that a lot of times people don't know how to work the test or interpret it properly. And that's what I want to help you with. Because when you're weathering a UTI or UTI like episode, only the knowledge that comes from understanding the test can help you weather the storm of experiencing UTI symptoms. First, let's talk about different types of UTI tests just to give a little bit of background. We're going to be talking about the urinary dipstick test today, which you can buy on Amazon or at your local drugstore. But there are other types of urine tests. There is a urinalysis with microscopic exam, which involves taking the urine, sending it to the lab, and someone literally uses a microscope to look at the urine and count red blood cells, white blood cells, and things like that. There are also urinary cultures where the urine is sent to the lab and they put the urine on a petri dish and bacteria on that plate grow. And that helps identify what kind of bacteria you may have and what the right antibiotic might be. Lastly, there are culture independent methods where you don't need to let the urine wait and grow bacteria. You send the pee sample to the lab and you're looking for the genetic material of different types of bacteria, viruses, or even fungus to identify them. Those are more advanced tests. What we're going to talk about today is your simple over the counter urinalysis dipstick test. In the case of a urinalysis dipstick, it often comes in a bottle just like this. There are different brands and different appearances to the sticks. Each of these little pads contains a reagent. A reagent is just a chemical that reacts with something in your urine to turn the pad different colors, which indicate whether you have white blood cells present, red blood cells, pH, protein, etc. This is a great test, but there are limitations to it because these are just reagents and little colored pads that can go bad if the tube is not stored properly. Also, there are things that can create false positives and false negatives on that reagent strip. So there are limitations, but it is actually a really powerful tool to just take a quick look at the urine. When should you proceed with a home UTI test? First of all, the most important piece of advice I have is do have some kind of a UTI symptom. So, specifically, blood in the urine, burning with urination, bladder irritation, and other UTI symptoms that might prompt concern that you have a urinary tract infection. Here's why. The test is actually designed to function its best in a population of people who have symptoms. So, without getting into the boring science of all that, just know that the test functions best in a symptomatic population, meaning people that aren't testing just because they want to take a look at their urine, but who are really having urinary tract symptoms. Regardless of if you are at home or at the doctor's office, the biggest side effect from using the pee dipstick incorrectly is you may get antibiotics when you don't need them. And I find that there's a lot of anxiety attached to using the urinalysis dipstick at home because while on one hand it's super helpful and it's giving you information, the strips have up to 10 or more things that they're testing for. And sometimes abnormal findings can cause people to worry unnecessarily. For the purposes of home UTI testing, if you have a urinalysis strip that has lots of different parameters on it, the best thing really is to focus on the nitrite and the leukocyte portion of your strip. And no matter the outcome of the test, meaning whether it's normal or not, your symptoms matter. Just because you're not testing positive for a UTI based on your home UTI test kit, there might still be something going on. So know that the home test kit, or this video for that matter, is not a substitute for seeing a medical provider and reviewing your symptoms and concerns about having an infection. Let's talk about product quality because there is a lot of confusion when you read online about what is a good dipstick. The FDA approval for home use is just for those two areas on the strip that test for nitrite and leukocytes. So it is not every single parameter on the stick. In terms of quality, it is really important that your product be sealed when you get it. If it's not sealed, you shouldn't use the strip simply because the air exposure to these strips can ruin their ability to react properly with the elements in your urine that it's testing for. So if your bottle isn't sealed, or let's say you forget and leave it open, I would consider those strips not to be usable. I also recommend using a company has FDA clearance for home use. My opinion is that those companies may be subject to more oversight and may have better quality control in terms of their dipsticks. And while some of the strips may be manufactured in different parts of the world, if they are manufactured there or here, but overseen by a company that has that FDA clearance and therefore that mark of quality and oversight, I think you're going to be better off even paying a little extra to get those dipsticks. Let's talk about actually doing the test at home. You want to start by not worrying about it too much because usually when people are doing a home UTI test, they have UTI symptoms. They're not feeling well. And some of the symptoms that are bothering them are actually things that might get in the way of getting a perfect test. For instance, it's ideal that you get your urine from the first pee that you have in the morning. That's nice, except for if your bladder and urethra are on fire because you're having bad UTI symptoms. In that case, you may not wait until the morning, and that's totally fine. Second, you should collect a midstream sample. This is because the first stream portion that comes out kind of washes away potential contaminant. But if you have trouble peeing and then giggling in the middle of your stream because things hurt, don't worry about it and do the best you can. In terms of washing up for the urine test, some of the advice, and just my opinion here, is a little bit of overkill. Essentially, we just want your vulva, the skin of your genitals, to be clean. And there's no sterilizing the inside of the vaginal opening and the urethra opening. So if you have showered and practiced normal hygiene, that's fine. The key is to not let the urine touch the skin of your labia, the vulva area, because that's what leads to contamination. The last tip is to wipe away discharge that you have from the vaginal opening because there's often some at the vaginal opening. That's totally normal, but we don't want that in the urine sample. Now you have collected your urine sample. How do we read the test? Well, that's pretty easy because they give you really clear instructions. You have your urine in a pee cup and you have your urinary testing strip, which sometimes is shorter with a little plastic holder, but some kind of a strip. You're going to dip into the urine and then pull it back out. Pay attention to the directions as to how long you wait before reading the result. You don't want to do it too soon and you don't want to wait too long. I recommend tapping the side of the urine stick after you've dipped it on a little napkin to get rid of extra urine. Then you're going to wait to see what happens with your nitrite and with your leukocyte. Here's the truth about the nitrite portion of the stick. The nitrite portion of the stick can be falsely positive if you've taken azo. That's the stuff that turns your pee a bright orange color. It's also what helps numb the urinary tract when you're having pain. If you've taken azo, your nitrite is going to light up positive, but it's a false positive. The other thing is you can get a false negative on your nitrite because nitrite is only produced by bacteria like E. coli and a couple of others. But there are bacteria that cause UTIs that don't make nitrite. So you could have a UTI and not test positive on the strip. But because E. coli causes 80% of the urinary infections, then you're most likely going to have a bacteria that makes nitrite. The other limitation is that the urine has to be in your bladder for at least several hours to register the nitrite. In other words, the bacteria are in the urine, they're making the nitrite. They have to be in the bladder long enough to make the test positive. So, if you're peeing frequently, which is what happens when people have a UTI, it is possible that you might test negative for nitrite. As for leukocyte, that comes back to your urine collection. We talked about midstream urine and trying to wipe vaginal discharge away before collection. And that's because white cells that come from your period or vaginal infection can end up in the urine, and then it's going to show that you have leukocytes. And also, vaginal infections or inflammation can cause burning with urination, frequency, and urgency. So sometimes vaginal infections perfectly mimic UTIs. And so there's a lot of women that I've seen over the years in practice that are getting sometimes multiple rounds of antibiotics for a UTI based on their urinary dipstick. And the whole time they just had a vaginal infection because the dipstick can't differentiate if this is a vaginal white cell or whether it's coming from your bladder. Now, I mentioned earlier that there are other chemical reagent pads along the dipstick to look at protein, blood, pH, and things like that. And those are great. I do use those in the clinic on a regular basis, but you do have to know how to interpret them, and they're not really FDA cleared for home use. For example, people see that their urine's positive for blood and get really scared about that. What I can tell you about the dipsticks is that they're notorious for false positives on the blood reagent pad. So just because you test positive for blood doesn't actually mean that you really have blood present in your urine. You do need a laboratory follow-up test to confirm if blood is or is not present in your urine. I guess a rule of thumb, if you have one of these that has multiple along the strip, would be anything that's very significantly out of range in the other pads on here that aren't the nitrates or leukocyte pad. Be cautious that the test could be wrong. Additionally, if those tests are positive, I would recommend seeing your medical provider. Absolutely. My last tip for the home test is to repeat the test if you're getting a result that doesn't make sense. Because if they don't, then it might be cause to think about whether or not your test strips are good and reliable. In summary, urine dipstick testing is widely available now. I think that's really great. My only complaint as a urologist, urogynecologist has been that people don't know how to interpret them, and that can lead to unnecessary antibiotics. And it can also lead to fear and anxiety when other test pads come up as positive or out of the normal range, and there's not really clear directions on how to interpret them. I think they're great as long as people understand that they really should be using the test when they have symptoms. If you have UTI symptoms, that is when the test is designed to work its best. With symptoms and a positive leukocyte and nitrite, there's an 80% predictive value that you do have a UTI. I also think it's important if you're using it to understand the potential pitfalls to give you a false positive and a false negative. And we went over those today because a false positive could lead to unnecessary antibiotics, and a false negative, you may not get the antibiotics and the care that you need. At the end of the day, it's not a substitute for actually seeing your medical provider. Thank you for joining me on BTV today to talk about urinalysis, dipstick testing, or home UTI test kit, and how they work for you and how they can work against you. Make sure to subscribe and hit the bell so that you know when new episodes come up. I love talking about pelvic health. If you know somebody who's struggling with UTI issues and could benefit from home testing, please share this video with them.